Hey everybody, I hope you're doing well. I wanted to pop on and give you a little post-brain surgery update. We are back in southern Maine, and it feels great to be back sleeping in our own bed and cooking in our own kitchen and back with our dog. I'm recovering quite well. I feel mostly pretty well. I definitely have some strange, bizarre symptoms, like a supersonic nose and a little bit of pain here and there. But overall, it's been a pretty miraculous recovery so far. I realize I'm not done yet. It's been a pretty big week here. I got my staples removed yesterday, which feels great not to have little bits of metal stuck in my head. And it will hopefully make me a lot more comfortable moving forward. I also had a meeting with my surgeon on Tuesday night, and the meeting started off by comparing the MRI I took prior to surgery with the MRI I took after surgery, and thankfully it looks like he got it all, which is really, really good news. Thank you, Dr. Smith. The pathology also came back on the tumor. It turns out that my tumor was an oligodendroglioma. That is a mouthful. It's a type of glioma that represents about 10% of gliomas out there. And unfortunately, there were some cells within the tumor that were faster growing and malignant. So they graded my tumor a grade 3 oligodendroglioma. This was not what we hoped for. We hoped for a grade 1 or grade 2, but unfortunately grade 3 means that it was cancerous. Luckily, Dr. Smith and I are very aligned in our approach to cancer, and ultimately I will continue on my ketogenic diet, which I would have done anyway, no matter how the pathology came back. And by ketogenic diet, I mean therapeutic carbohydrate restriction, where I'm consuming no more than 20 total carbs per day in the forms of vegetables, along with meat and healthy fats. I will also continue to address other factors that may have played a part in my tumor, and will definitely help me avoid a reoccurrence. For those of you who don't know, I do have a background in oncology nutrition, and I went to the Oncology Nutrition Institute and graduated in 2022. That program was created by one of the authors of this book, Jess Kelly, and the other author of this book is Dr. Naisha Winters, who is a phenomenal integrative oncology doctor. And she essentially, in addition to working with patients, she instructs physicians and other practitioners on how to work with various aspects of your body's terrain, if you imagine it like a garden, so that cancer is discouraged from growing there. If you imagine cancer kind of like a weed, we're trying to avoid that. And there are lots of aspects of your terrain that you can make significant changes in. And this is something I've been very focused on over the past 2 months since I found out I had a brain tumor in the first place. But I will continue to work on these terrain 10, as we call them, from the metabolic approach to cancer. And I will talk to you guys more about that in the coming weeks of what I'm doing to help prevent a reoccurrence of cancer. So I want to thank everyone for reaching out to me and for asking me how I am, and for letting me know that you're thinking of me. I really appreciate that. I apologize if I'm not always able to respond. I'm dealing with a lot of the emotions that come with a cancer diagnosis, and trying to do my best to take care of myself. So if I haven't responded in a timely manner, I apologize. It's just hard to rehash it over and over and over and over again. So hopefully this video can help fill you in. I may have to step back from certain activities and watch my schedule very carefully so that I can maintain very low stress levels. That's one of the terrain 10, stress. Sometimes that may mean that I won't be able to go out to dinner. Eating out on my diet is really difficult. Alcohol is also off the table, unfortunately, but a great sparkling water is delicious. Anyway, I hope all of you are well. Thank you again for your support during this crazy time and this insane process. I hope you have a great day. Enjoy 420 if that's your boat.